Hey guys, good morning. Hey, coming to you from Tutzing, Germany, Bavaria, southern Bavaria. Today, just talking about benzos a little bit, and I'll be talking about benzos a lot as we go through this. A lot of you guys already know that I'm kind of the doc that's not so in favor of benzodiazepines, just because of the amount of addiction and dependency that they produce. So I try to steer away from them at all times possible. Definitely do have to use them. They have a very important role. So when they are needed, they're needed, and you got to use them. But very often they get overused because they're convenient, they're quick, they give people rapid results, and that grants that instant gratification that we all love to have. But when it comes to treating anxiety that's been around for years and years and decades, it's not about instant gratification, is it? We all know that it's about the long haul. It's not the sprint, it's the marathon. We all know that. Why do doctors prescribe so many benzos? Part of it's the wow factor. It's nice as a doctor to be able to provide your patient with something that gives them an instant, immediate wow factor and relief, which is amazing. It's great. But we have to get past that and realize that at times that's not appropriate. Yes, there are times when that's necessary, okay? So let's make an analogy, a similarity. Say, for example, you break your arm. We need to give you Percocet, fast-acting, quick wow factor, medication to give you, quick pain relief, which is fantastic. Nothing wrong with that for a couple of days or a week or so if you break an arm, but not for the long haul. When the little old lady comes in saying, hey, would you please give me Percocet every day, because it just works so well and it's so amazing and it takes care of my pain so quickly, and can't we just use it every day for my arthritis? You would say, no, of course not. That's not the right way to treat arthritis. The proper way is we have to do Advil, Motrin, muscle relaxers, physical therapy. That's how we treat long-term arthritis. And because it's about the safe treatment long-term, not the quick, short, dirty. But people get dependent on benzos because doctors have prescribed them for the quick relief. They're almost like that little fire extinguisher, the one we have in our kitchens, that little teeny little fire extinguisher. It's meant for the occasional grease fire, okay? It's great to have in your kitchen. If you need it for an occasional grease fire, that's perfect. That's what it's for. Those little fire extinguishers are not to be used every day. If you do need one every day, probably you should be looking at what you're doing in your kitchen a little differently, Like, if you need a fire extinguisher every day in your kitchen, probably you need to be looking at how to do things differently in your cooking strategy overall. That's not going to work. Same for firemen. Firemen don't run into a burning building with an armful of fire extinguishers, do they? Nope. They unravel that big long fire hose, hook it up properly to an outlet, and then walk into a building with the proper gear. They don't just run in with a handful of fire extinguishers. Can they get away with it once in a while? Yeah, you might. Can the kitchen get away with 10 fire extinguishers a month? They might. But sooner than later, we all know it's going to bite them. And we know it's going to bite them badly. That's why they don't do it. Firemen don't do it. Chefs don't do it that way. And in the medical world, we shouldn't be doing it either, right? We're playing with people's lives. That's not proper. So yes, the benzodiazepines have a place. No, that place is not long-term anxiety control. Yes, sure, it's fine for something short-term. Something big happens in your life. Close relative dies or something. That's perfectly fine, or the occasional panic attack. By the way, of all the benzos, Xanax is probably the least favorite because it is the most rapid acting and provides the most potential for abuse and tolerance, which means it kind of wears off over time. But it's really the abuse potential. And that's the one that's involved in most of the 50,000 deaths a year from people that are dying. They're combining Xanax with painkillers, Xanax with gabapentin, Xanax with other medications that suppress breathing. That's where most of them die from, is that combination. It's not just they're dying on their own. Anyway, we'll keep talking about the benzos a lot more, but I like to reassure patients I'm all about prescribing them when they're proper, especially for that person who says, hey, a handful of times a month, I just need a benzo, like a safer one like clonazepam, just to slam down a really bad panic situation. Nothing wrong, as long as we're also treating the underlying big picture, the underlying anxiety disorder. It's just like the little old lady with the arthritis. We don't want to be just treating when she comes in and says, hey, for those really bad days in a month with my arthritis, can I have an occasional Percocet? I'll say, yeah, that's not a problem at all. That's perfectly fine. But we don't want to be doing that with the ignorance of not taking care of the actual big picture, which involves the anti-inflammatories, physical therapy, and so forth. You guys all get that. My business is the same as yours. We all do the same. I don't care if you're an IT manager or a chef or a fireman. We use the safest, most logical treatments the most, and the least safe, most precarious treatments the least, or not at all. It's the same for all of us, guys. Talk to you soon, okay? Thanks, Mike.